Hi, I'm Steve Leon, Physician Assistant, and I am the Medicare Clinical Consultant for WartPeel. Today we're going to go over how WartPeel can be a highly effective treatment for male genital warts. WartPeel is a highly effective treatment for male genital warts. Genital warts are thinner and softer than other types of warts like plantar warts or palmar warts, and so they respond faster. Typically in about 5 to 7 days they swell, crust, and then fall off. WartPeel should not be used on mucous membranes, which means you don't want to use it on perianal warts. It's too difficult to apply, it can cause too much irritation, and applying it in areas where skin touches skin is problematic. Since I rarely treat female genital warts, I can't recommend it for this purpose, although some of my colleagues have had success with it. If you do use it for that purpose, just follow all the principles outlined in these presentations and let me know what your success rate is with WartPeel for female external genital warts. In 2020, I started a telemedicine site, fixwarts.com. I did that because many people were sending me pictures of their warts and their family members' warts, and almost all of those warts could be treated with WartPeel. And there was a lot of talk about telemedicine at that time, and I got the entrepreneurial bug, so I designed a website and started marketing wart treatments to be done over the internet. And I put out advertisements for every type of wart, even molluscum contagiosum, and by far the most interest I got was male genital wart. I got so much interest and so much return for that advertising, I decided just to advertise for male genital warts. Many of these men who contacted me have failed many treatments, and they felt much more comfortable being treated over telemedicine than in person. I routinely offered patients to send me follow-up pictures, but few actually did. They really didn't want to subject themselves to the embarrassment of sending pictures in again, and the WartPeel was working so well, so fast, most of them didn't feel the need to. I treated hundreds of patients on the site, and very few people contacted me because their warts wound up coming back. The feedback was overwhelmingly positive, and the WartPeel proved to be predictively very highly effective for male genital warts. The current topical treatments, they can take a long time to work, like Aldera and Varigan. They can be highly irritating, and they're definitely not ideal for a condition where men are desperate to get rid of their genital warts. Eventually, I decided to close down the site in favor of working directly with Medicare to educate prescribers on how to use WartPeel. I figured I could reach a lot more people that way than direct marketing over the internet. But maybe one day I'll get back to that. After seeing so many male genital wart patients, I realized I had been underestimating the psychological impact warts had on patients. Not only is it's devastating to their sex life, but that isn't all. It also affects their social life, their self-esteem, it affects them psychologically. Mostly, genital wart sufferers feel stigmatized. Many genital wart sufferers feel like they've done something wrong. Combined with that, they also feel disgusted by themselves because warts, let's face it, are disgusting. We all have that reaction when we look at warts. Maybe not people who look at them all the time, like dermatology professionals or podiatrists or other medical professionals, but people who have warts definitely do, and other people who look at their warts definitely have that knee-jerk reaction that warts are disgusting. And this feeling of stigmatization is really not deserved with genital warts. Here's two statistics that you should find interesting. One is that when they look for the antibodies for genital warts in the general population, about 75% of people have them. And two, when they do random cultures of patients' genital tracts, about 50% have genital wart virus in their genital tract. So it's very, very common. But because it's sexual, people obsess over it and they feel dirty and they feel like they've done something wrong to deserve it. There's also stress caused by the treatment. The treatment times, if they're not surgical, you're not really sure how long it's going to take to work or if it's going to work at all. Patients are also very stressed about new warts coming back. There's a lot of uncertainty, which is something that you don't want when you're feeling this bad about yourself. Whenever I have a male genital wart patient, I like to explain all the treatment options. Don't just talk about WartPeel, even though I think it's great. Everyone has different needs, different insurances, etc. So here is how I explain it. I tell them freezing might work, but there are no guarantees, and there's going to be a bit of healing time, but your insurance does cover that. Now, if you don't get a good response, we can always move on towards other treatments. Your insurance also covers certain creams, but they take a few months to work, and their cure rate isn't that great. But if you're the type of person who will consistently put them on, they may be worth a try. Here you'll have certain patients who know they're not going to be consistent with the treatment, realize that, and shy away from this treatment option. Hyfurcation or burning it off works well. We put some numbing cream there, which takes away most of the pain from the injections. We do that first, and then we burn off the lesions. The success rate's pretty high, and usually the warts don't come back. Now, this obviously sounds like a great treatment for people, and I've had a lot of success with it because numbing cream works very well on the thin skin male genitals. But as you may imagine, whether you tell people the numbing cream is going to work great or not, a lot of people really don't want to have a shot down there. And finally, I talk about WartPeel. I say there's a compounded medicine called WartPeel. It has a very high success rate. Insurance doesn't cover it. It costs $95. You put it on nightly for 5 to 7 days. There's some minor stinging. The warts swell a little bit, they crust, and they fall off, but it really isn't bad, and almost everyone can complete the treatment. One of the best things about it is if new warts come up, which is always possible that there's a new wart incubating, you can treat it right then and there yourself, and you can stop that wart from spreading and forming new warts. So you can see now how I explain genital wart treatment and why the majority of people select WartPeel. Not everyone, I would say about 70% of people. Some people have had freezing in the past, and some have had it work well, so they want freezing again. Just remember, if you're used to prescribing the usual standard topical medicines for genital warts, keep in mind that many patients with male genital warts, they're traumatized by the experience of having them. They're suffering, they feel disgusting, they feel stigmatized. Go that extra mile. Talk about the highly effective treatments like hyfurcation and like WartPeel. These men may not show it, but many of them are looking for fast treatment, and they're looking for their genital warts to end quickly. Let's take a look at a patient with a severe case of genital wart. This is a 26-year-old male with a case of recalcitrant genital warts. He'd failed cryotherapy and Aldera both, and he'd had them for over a year. He complained about the irritation and the painfulness of both treatments. Most people would look at a case like this and be hesitant to freeze all those warts. You would probably maybe do half of them. Some people might do all of them. I could see why people would think that topical treatment is good for this particular case, because they could spread the topical treatment over a wide area. But needless to say, this is a difficult case. But as you'll see with WartPeel, it was not a difficult case. It resolved quickly, and the patient was satisfied. So this is after 5 days of treatment. Applying WartPeel to a thin-skinned area, you're going to get crusting and then sloughing after about 5 days or maybe 7 days. This is after 5 days. So after 5 days, the patient actually sent me an email and said the warts are still there. And I looked and said, these are not warts, these are crusts. And I had told them to take a long shower or soak the area and then gently wipe the area, and these crusts will come off. And that is exactly what happened, as we'll see in the next slide. So this is what it looked like the very next day after he followed my instructions. So I advise this patient to use it on those areas maybe another day or two, not because I thought the areas that crusted and fell off still had warts there, but this is what I tell almost all my patients with WartPeel, because the chance of scarring is so low. If they're applying it to the exposed dermis, it'll start to sting and they'll stop. This particular patient, you have to let them know to inspect themselves daily, treat any new warts as soon as they come up. He actually still has a few warts left, you can see in the picture. But this is a patient where it would be important, not crucial, but it would be a good idea to follow them up in the clinic. This is a hard area for a patient to completely inspect themselves. They may be missing a wart or two. This particular person did a very good job, and on a follow-up email said his warts were gone and he had just needed to treat a few new ones which had come up. With this patient, I was lucky enough to get a picture 1 week after he stopped treatment. You can see the area has epithelialized, and it's normal to have a little swelling for the first few days afterwards, after the new skin has come in. Now, you may think this patient was in a lot of pain because he treated so many warts, and just looking at the previous pictures, you're thinking, God, that must have hurt. But WartPeel on the male genitals is remarkably tolerable. Most patients don't really talk about how much it stings. It's not much of a problem. And with genital wart patients, especially WartPeel patients, you'll find that a lot of them are lost to follow-up because the medication works very well. They see the warts coming off, and for obvious reasons, they don't want to come in and bare themselves for another inspection. So don't be surprised if some of these patients don't come back, even the patients with very severe cases. Feel free to give them a call, though, because some of them are shy about coming back. And especially for your darker skin types, you want to educate them about post-inflammatory hyperpigmentation. Genital wart patients are very concerned that the warts are still there, and oftentimes will mistake post-inflammatory hyperpigmentation for warts. With male genital warts, some patients need follow-ups more than others. This patient had warts in many areas, including the ventral side of the penis. This is a very difficult area to look at yourself. So this was one of my internet patients, and it looks like he was doing a good job treating warts in other areas, but as you can see, I circled an area where the warts were only partially treated. And this was very helpful for him because he could not see those himself. Maybe with a mirror he could, but he was unaware that those areas still needed treatment. And now that most of us are using telemedicine, keep in mind that male genital wart patients may prefer a telemedicine follow-up. Just ask them. That concludes our presentation. At Medcara, we believe in standing behind our product and supporting our prescribers to get the best possible results from WartPeel. That's why I'm available to answer questions, to go over cases by phone, text, or email, and I'll respond the same day or the next business day. I can also do a virtual presentation for your office or professional organization. And don't forget about all the educational resources at WartPeel.com. I'm Steve Leon, Physician Assistant, Clinical Consultant for Medcara and WartPeel. Thank you for listening.